Dana, a special guest who has a lot of history.
A lot of history. They don't call him the Dean of the House for nothing, and we're talking about John Dingell. He is here with me, and he has something very special. Mr. Dingell, thank you very much for joining us here. Tell us about this gavel. This is a lot of history here.
Well, the gavel was used when I presided over the House when we passed Medicare.
Hold it up there so our viewers can see it.
And it was used when I presided over the House when we passed the House version of the health care reform bill. And it's going to be used when Speaker Pelosi gavels the bill into law tonight. And this bill is a great piece of legislation. It ranks with Medicare, it ranks with the first civil rights bill, and it ranks with Social Security, of which it was intended to be a part when Roosevelt started that out in 1935.
Now, the president talks a lot about the history of this moment. He talked a lot about it when he came to speak to you and the caucus yesterday. But you've lived the history. You started introducing health care legislation in
1957.
1957.
Dad introduced the first bill in 1943 for Harry Truman. It was the Dingell-Murray-Wagner bill, which he introduced with his two friends in the Senate. And it has, believe it or not, much of it has been enacted into law. And I reduced the bill when I introduced it because of all the legislation that had been enacted as parts of this bill. So it's going to go through. It's going to do some wonderful good. It's going to change the situation where the United States ranks with the developing nations in terms of the health of our people.
Now, let me ask you a question. We actually saw the speaker earlier. She was carrying the current gavel, her gavel, the one that she uses. This, if you can hold this up against her, hers is a lot bigger now. I don't know if it's just gotten bigger in size as time has gone on, or give us a little bit more about the history of this gavel. Was this your father's gavel?
No, John, that wonderful Irish poet, Speaker John McCormick, gave it to me when I had finished presiding. Just as a joke this morning before the caucus, I gave the speaker a gavel that was given to me by my friends in Monroe County. It's about 3 feet long, and it weighs about 5 pounds. And I said, Madam Speaker, if they get out of order, this will bring them back.
So this is one that you're going to hand her. To be clear, this is the one you're going to hand her tonight to gavel this vote closed.
Well, and it's got a lot of history. But more importantly, the history is really important. We're going to eliminate all of the abuse that the insurance companies have. Pre-existing conditions, canceling your policy while you're on the gurney going in the operating room, lifetime limits. It's going to see to it that small businesses are no longer discriminated against on price, and they're going to get a subsidy. It's going to eliminate a $1,600 disadvantage that American automobile manufacturers have on a car. It's going to see to it that the citizen has a free choice of insurance, and he'll get insurance as good as we get here in the Congress.
Thank you. I think you have to go vote. I see your staff pulling you over to make sure you can do it. I appreciate you coming over and showing us this historic gavel and giving us a little bit of a history lesson as well. I appreciate it.
You're a great, good sport. Thank you.
Thank you very much. And more of our coverage of this health care debate right after the break.